Shot. Shot. AP. Welcome to Deuk Spine Institute. I'm Dr. Deuk Majan. Our patient is having the Deuk laser disc repair done, cervical spine, C5-C7 shot. He has 2 herniated discs, number 5-6, number 6-7. They're causing horrible pain in his neck, headaches, radicular, cervical brachial, everything that the disc herniations cause. We need to pull on the shoulder. Shot. There it is. You see the tear in the back of the disc and the herniation.
Yes, we do.
2, 3, 4, 5, 6. He absolutely did not want a fusion. We talked about other types of treatment. He wanted the Deuk laser disc repair shot. He had done his research. He comes from Port St. Lucie. He's a Floridian. And he had watched a lot of our surgeries, watched a lot of these surgeries that you're watching, and decided that he was going to have this procedure done. Hold this. Rather than open surgery. You've seen the horror stories, people with fusions, artificial discs, incision. Our incision is 4 millimeters. In just 4 millimeters, we're going to fix this guy's disc. Shot. All right, I need the dilator. First step is placement of the guide wire, needle and guide wire. Then I'm going to bring the dilator. The dilator is what I use to separate soft tissues. Henry, let's show the audience, why do people get so much discomfort in their neck, headaches, arms from a cervical disc herniation? All right, so you can see from our video that center that up and take a look at this picture here, guys. You can see the dye in the disc, it's dark. Take a picture, Jordan. And then you can see it leaking out on both sides through tears in the back of the disc. Those are the annular tears we talk about. All right, lateral, please. And those are the tears where people get inflammation, and that's what causes neck pain. Disc herniations, inflammation. Take it out. This patient is no different. It's like everybody else. 85% of neck pain comes from herniated discs. Tube. The other 15% comes from facet joint pain. We've lost about a drop of blood, maybe 2. This is bloodless surgery, no hospitalization, and no need for metal hardware implants. Okay. No need for fusion. That's good. Little inline. No need for artificial discs. No need for bone graft, biologics, implants, PRP, stem cells, nothing. All natural. Going to go in and clean out the back of the disc where all the pain and symptoms are coming from. And I would expect over 90% of his symptoms to go away. I told him less than 90. I told him probably 85. And he was very happy with that. But our average is around 95% pain relief. All right, Henry, let's show the audience how it is the Deuk laser disc repair works with our older video, since we don't have the newer one yet.
Copy that.
And welcome back. Let's leave it there for now. All right. You can see from our video that we're using the endoscope to get to the back of the disc, and we're using our laser to clean the tear and get rid of the herniation stuck in the tear. It's this herniation right here that I'm zapping right now with the laser. That is the herniation you saw in the video. That's what's in there causing all the symptoms. Horrible inflammation. And the worst thing about it, lots of surgeons that do spine surgery, that do fusions, they actually never take this out. They leave it in there. And that's why so many people don't do well with spine surgery. The surgeons aren't doing the surgery the right way. They're leaving the herniation in the back of the disc and just fusing. All right? You have to remove the herniation in the back of the disc all the way down to the spinal cord and nerves in order to get rid of a patient's symptoms. But probably 90% of spine surgeons don't do the surgery properly. So even when they do an ACDF, they don't get good results for the patient because they're not doing the surgery properly. They're just fusing. They don't do the actual posterior decompressive discectomy. They do an anterior discectomy where they take the front of the disc out and leave the back where the herniation is. And that's the part that causes all the symptoms. Why do they do that? Because what they're doing is much easier. Just removing the front of the disc is safer, easier for them. They don't have the skill and training to do what needs to be done. Okay? As a patient, you want a surgeon who's going to do what's best for you. That means go to the back of the disc, remove the herniation in the back. See all the scar tissue, by the way? This is the covering just above the spinal cord, and it's got that strandy look because it's got scar tissue from inflammation. This is herniation right here in the foramen on the right side. Now he's got bilateral, there's a herniation. See that? Just came right out of the foramen.
Yes, we did.
That was sitting on top of the nerve in the foramen, causing cervical brachial pain, cervical radiculopathy. Okay? Came out of that little hole right there. There's more in there. We're not done. We've got 2 discs to fix. We're going to fix them both. We're starting on the first one, 5-6. See where that hole where the herniation came right there, that little cavity? Now, what's this white stuff? That's called posterior longitudinal ligament. It's oriented, as you see it, left to right, but it's really up and down. That's superior to inferior. Now, behind that is the spinal cord. Now, I don't remove the PLL unless I have to. I only remove the PLL if I think there's a herniation behind it. You could clearly see it's intact. We don't have to remove it. If I'm not sure, I'll actually go and put a hole in the PLL and see if I can find a herniation behind it. But most herniated discs in the neck are subligamentous. They don't go behind the ligament. They stay on the disc side where we are, and you don't have to go through the ligament. That's the posterior longitudinal ligament I'm referring to. You don't have to go through it with your instruments to look on the other side. You don't need to, because 90% of herniations are subligamentous and you don't have to explore the epidural space. There's the nerve down there, by the way down there. I don't know if you can see it, but this is all scar tissue and herniation that's touching the nerve. I'm getting rid of it. He's going to do so well with this surgery. I'm convinced of it. How do we know a patient's a good candidate? Number one, they have neck pain. Number two, their MRI shows a problem we can fix. Number three, their physical exam is consistent with a problem we can fix, like disc problem or facet problem. Okay? When I see those findings, I feel very confident the surgery is going to work. His case, I felt very confident it was going to work. I was just worried because he's had some other stuff done on his neck, some other treatments that could affect the outcome. All right, we're going to flip it, and you can see more pieces of herniation. Many people don't realize that a herniated disc is actually about 30 pieces of herniation, not one. And they think they just have one herniation. A lot of surgeons don't even know herniated disc is really like 30 pieces. Everything good? What's going on? I got about 3 minutes or 5 minutes max on this disc, and then we're going to move on to the next one, which is 6-7. How relaxed is he? All right. I'm going to need him as relaxed as possible to be able to move to the next disc. All right, let's keep it that way. On the what? We're going to be very slow on his wake up. Well, I understand. And do what you need to do. You're going to put what's it called in there? A guide. You're going to leave a guide in there? No, the long guide thing that you can re-innovate over. What is it called? It's like a plasticky, rubbery thing that you stick past the vocal cords, and you not the metal one. It's like a bouger or something. I can't remember what they call it. I don't remember what it is, but yeah, that way you could re-innovate over it if you need to. You know what I'm talking about? Yeah, it's like a bougie tube, right? Yeah, it's like a brownish color.
You can't really leave that in with a weight station.
Well, I know, but once he starts to wake up, you pull it out. Right? Once he starts coughing, you rip it out. I see. So you're going to propofol him? Get him breathing, huh? Good. All right. Any questions from our audience, Henry?
At this moment, no current questions.
Do we have an audience?
Yes, we do.
Fantastic.
Yeah, we got it from all of our platforms. Everybody's viewing.
Good. All right. Another herniation coming out of the framing. You guys see that thing? Just popped out of there.
Yes, we do.
That should not be there. It's not coming out easy. I'm going to go grab it with the grabber since it's too big for me to get it out. I think that, did I get it or not? Maybe at the top there? No? Hard for me to see. Take that. Can't tell if I got it or not. All right. Well, that looks like it right there. So I'm going to try to grab it again. I think I got a piece of it last time. Just a little piece again. It seems to be fragmenting. Oh. Little pain in the butt. When they misbehave and don't want to come out, I have to laser them a little bit. Break them up into smaller little pieces, and then hope I can get them out. Let me try grabbing that one. But you can see this patient has more than one herniation. It's a lot. So far we've seen at least 15, 20 pieces. There we go. Look at that. You guys see that?
Yes, we do.
If at first you don't succeed, try again. Yeah, good. All right, just about done. I just keep looking, I keep finding more pieces of herniation. They're coming out of the woodworks. Wow, look how pretty that is. Guys, what a view, huh? The PLL right there. Foraminal ligament. And the nerve is just, whoa, there's another piece coming out. So how do you get so many herniated pieces? Well, basically trauma. That's the long and short of it. You have a smash to your neck, whiplash, and it crushes the disc, crushes and tears the annulus. And once the pieces of herniation get stuck within the tear, they never go away. All they do is cause pain. It's like a thorn being in your skin. A thorn that can never go away on its own. You need Dr. Deuk Majin to go in and get it out. And that's why I pioneered this technology, is to do just that. All right, just about done. I don't see much left back here. It looks really clean. Any questions?
Yes, we have a question coming from Lanu on YouTube.
What a surprise. Hello, Lanu.
They asked, have you ever visited Armenia before, and do you have any relatives there?
I do have relatives in Armenia, and I have visited Armenia. I was there in 1985, and I almost died. I got sick, and I went into a coma for 2 days. Woke up. I was at a camp. There was no doctors or nurses. I got some type of an infection, I guess. I think in Moscow. I ate this really bad meat. 2 days or a day later or 2 days later, I mean, I was gone. And I was only 15. My cousin, who was 14, said, when I woke up and I came out of the coma, he said, "Oh, it's good to have you back." I said, "What do you mean?" He says, "You've been asleep for 2 days." I said, "What do you mean asleep for 2 days?" "Asleep so that we couldn't wake you up." I said, "Oh, nice." And I said, "Did they bring the doctor?" And he said, "No." "Did they have a nurse?" "No." "What did they have?" "Oh, just some lady sat and watched you for 2 days." Anyway, I spent a month in Armenia, very poor country, and got to see some museums, churches, toured with students, all 14, 15-year-olds from around the world, all Armenians. Beautiful. We're done here. Anyway, crazy, huh, to think about it. How close I came to not being here.
Hi, Tom, please. Thank you.
Went with the church camp, 300 students, all 14, 15-year-olds from around the world. And other than that, it was a great trip. All right, let's move down to 6-7. Bring the fluoro back in. I'll need a little shoulder pull. I'll need a little neck inline traction extension. We will take this tube out and leave the dilator, and then I'll move the dilator down to 6-7. You have a coker ready? Any other questions? This movement here, it's called the Deuk spine slide. I was the first in the world to do it, and as far as I know, the only one in the world who does it. And it's basically moving from one disc to the next. I learned the endoscopic procedure without the laser from the Koreans. They did one disc at a time. They did it with the patient awake. And I pioneered moving the, basically doing more than one disc at a time. Shot? All right, looking good, Jordan. You're doing a great job. We're going to try to get down to the next one. Shot? And I'm going to pop out right now. Yep. I'm right on the cusp. Shot. There it is. I could feel it. And I'm going to try to get down south. There we go. Yeah, you felt it too, huh? Shot. All right. I need to make sure I'm still in the middle of the spine, so we're going to get an AP view as I move. Look at that. Bloodless surgery. 1 drop of blood. The whole surgery, 1 drop of blood. Jehovah's Witnesses love this surgery, south. Lateral, I mean. Let's go lateral. Because we don't lose blood. It's not open surgery. I've had Jehovah's Witnesses come here for this surgery. Shot. That's it. All right. We're going to try to make it down south. Shot. Almost there. A lot of scar tissue. Shot. Let's get another AP. Make sure we're still in the middle. Almost there. Any questions?
Yes, we have another question coming from Lanu once more on YouTube, asking, there are only 21 Armenians living in Taiwan. Armenians are very peaceful people. Why did Armenians suffer so much in their history?
Yeah, it's a great question. Thank you for noticing. The reason is because Armenians are Christians and they're surrounded by Muslim countries. Nothing against Muslim people, but the Ottoman Turkish Empire was Muslim, shot, and Armenians are very industrious people. We don't just sit around and don't do anything. We're not lazy. We work hard. We produce. We create. And so, of course, anytime you have one ethnic group who's productive and another ethnic group who's militaristic and jealous, there's always a potential for conflict, and that's what happened. The Turks went into a time in their history where they were interested in conquest and taking things from people. So, shot, they took from the Armenians. Let's see where we are, because I want to check. So they basically killed all the Armenians, 1.5 million, and took our land, took our farms, took our possessions, murdered babies, mothers, children, threw them in the ocean. let them drown. It was a genocide, just like the genocide for the Jews with the Nazis. It was hatred, jealousy, ignorance that drove it, AP. And, you know, history has repeated itself many times throughout centuries. Armenians are peaceful people. We don't fight. We're not a militaristic society. If we did, we'd probably be gone by now because we don't have the military resources that some of the countries around us have. You could see now with this conflict with Azerbaijan, which is, again, descendants of the Turkish Empire, that Armenia struggles. So I guess we just let ourselves get bullied a little too much. Shot? Trust me, if I was running Armenia, things would be different. Very different. Shot? But I'm not. Shot? And I have no interest in running Armenia. Armenia is a great people. Remember that. All right. Not really getting any juice to come out. Let's get another AP. See where we are. Do one more. There's a lot of scar tissue here. I'm having trouble getting in. We are going to need to get a more lateral view further up so I can verify levels. Shot. But on the AP we can usually see too. All right. So we're off to the side, but it looks like we went in and we've already gone off to the side. So let's see if we can fix that. Lateral. So I'm hitting the uncovertebral joint. That's why I'm having so much trouble. All right, so I'm going to pull back. Shot. All right, shot. Let's give me an AP. AP, quickly. Shot. Yeah, the AP doesn't look too bad. Maybe, give me a better AP. It looks like we got rotation here, guys. Come on. That's better. All right, so I'm gonna go to the left. You gotta, I can't see what I'm doing, Jordan. You gotta move that floor out of the way. All right. Yep, lateral. All right, I'm gonna try to come out a little bit and move shot slightly to the left. Shot. Yeah, there's a lot of scar tissue in his neck. I can tell you that. Shot. All right, AP. So I'm trying to get this thing perfect right over his disc. Quickly. See, that looks good. Lateral. I think. Shot. Let's clean it. Let's try this again. Shot. That looks good. That's better. See if we can get a discogram. Shot. A lot of scar tissue. Yeah, we're getting some of the dye out, finally. I'm going to advance this. Shot. 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 I'm really struggling here. AP, huh? I know, but I'm fighting his collarbone, I'm fighting his thick neck, and I'm fighting his scar tissue. Shot. Come on, Jordan. All right, so Let's get the tube in. You can see the dilator is actually bending from all the force I'm having to use to try to straighten it out. Shot. It's actually pushed back. Might be able to do a little better if I have that additional support of the tube. Shot. All right. Go ahead. Uh-huh. Yeah, it's just really... You sure he's relaxed? Get that back on there. Shot. I'm going to try to aim a little bit to his right. Shot. Feel like I'm fighting muscle. Shot. AP. Huh? Just... Yeah, I knew it.
Try to give him some more. It's got one twitch.
No, I think one twitch is fine. Yeah, I think a lot of it is prior issues. Shot. Shot. I gotta try to just move over again. For some reason his anatomy is forcing me. Shot.
Maybe make a separate incision.
Don't want to do that. Shot. All right. I'm gonna try to come down. Shot. Now, that's where we need to be. AP. It's just for some reason his spine is pushing me back to the same spot. See, now we're a little bit off to the other side. Are you sure his spine is straight there? Shot. That looks good. Lateral. Don't move anything. I'm really fighting him. Shot. 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 All right. Damn it. Shot. Now let's get a quick AP. Coker. I think I was able to move out of that other rut spot. That's better. It's a lot better.
Give a little chin thrust.
Shot.
Touch his chin a little bit. Throw his chin up.
That was not an easy one.
Feels like
Give me that thing on top. The impactor, huh? Yeah, no, we're definitely better at this point. Shot. This I can work with. Hold on. Take it off. Take off. Shot. No. That's it. All right, we got as good as we're going to get it. I'm happy with that. 1 drop of blood. Had some challenge there. His anatomy was forcing me to the left, but we repositioned twice and we finally got it. Any questions?
Yes, we have another question coming from Lanu once more on YouTube, asking, I met so many Armenians in the medical industry. Is the medical industry very popular in Armenian culture?
I don't know. It's a great question. I honestly don't know the answer to that. I didn't think there were that many, but maybe you probably know more than I do. It's a great question. I don't know the answer. There are definitely a lot of Armenians in medicine. You know, Armenians are intellectual people for the most part. I'm making a generalization, but they like the doctor type of jobs. I've met a few. I've met a couple of neurosurgeon Armenians. My brother is Armenian. He's a neurosurgeon as well. There's a few others that I've met. I need 8 minutes, doctor. 8 minutes. Oh, this thing is not coming out. All right, Henry.
Yes, sir.
This patient didn't have facet joint pain, but other people do, and I think it would be nice if you showed our animation on cervical facet syndrome and what is it, how it works, how it causes pain.
Not a problem.
Just in case somebody out there is interested in knowing.
Of course.
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. Facet joint pain is the Deuk plasma rhizotomy. The inflamed facet joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
All right. Well, hopefully you enjoyed our animation from Deuk Spine on cervical facet pain, how it's created by arthritis within the joint, and how we fix it. Did we show the DPR, Deuk plasma rhizotomy?
Yes. Yes, we did.
Yeah. When it comes to facet joint pain, folks, it's arthritis in the facet joint causing pain, and there is no cure for arthritis, so the best we can do is eliminate pain. And the way we used to do it, we would just fuse the bones with fusion. ACDF, PCDF. If there was nerve root symptoms, we would do a laminectomy, foraminotomy to get rid of the spinal cord or nerve root compression. But then we would fuse to get rid of the arthritis pain in the joints. Now with the Deuk plasma rhizotomy, it's far less invasive. By the way, our person from Taiwan, we actually had a Singapore patient here just last week or the week before, maybe it was 2 weeks ago. When was it? 2 weeks ago? One of our patients is a lady from Singapore. She had the DLDR and the DPR in her neck. She went back to Singapore very happy. So we get patients from all over the world. They travel here for our care. And some just come from Florida, like this patient. Any other questions?
No current questions, but we do have a comment from, I love this name, Vertebrologist on YouTube.
All right.
And they just said, hello from Russia.
Hello, my Russian friend. How are you? Welcome to our live stream. Good to have you. Thanks for joining us. If you have questions, feel free to ask. We will do our best. We are in the middle of a surgery on the disc C5-C7, C6-7. This patient has 2 herniated discs, C5-C7, C6-7. What you're seeing is the very back of the disc with the scope, and I have a laser. I'm using the laser to remove pieces of herniation and scar tissue and bone spurs as needed, cleaning out the herniation so that the disc will heal. If you remove this stuff here endoscopically, we call this procedure the Deuk laser disc repair because it was pioneered by me here at Deuk Spine 18 years ago. We've published it, and you can see that we're removing pieces of herniation from the back of the disc. Now, because we're not taking the front of the disc out, there's no need to put a cage, no need for fusion, no need for artificial disc. We are leaving the natural front of the disc there. When I say front, I mean 95% of the disc is remaining. I need 3 minutes, 3 minutes. Our patient is completely asleep under general endotracheal anesthesia with neuromuscular blockade. And my anesthesiologist and I are in constant communication. I'm telling him that I'm almost done. And that way he can prepare to wake the patient up, resuscitate them. Our patients are here outpatient. Every one of these patients goes home an hour or two after their surgery is completed. This patient will go home in 2 hours. Okay, they do not drive themselves. We make sure they have a ride. They're not allowed to drive themselves after anesthesia. But he'll be walking and eating dinner and could go to the movies tonight. This incision is 4 millimeters. There is, again, no need for post-operative painkillers because we're not doing any disruption to the tissues. Unlike open surgery where patients are given Percocets or oxycodone, Dilaudid, all these powerful pain medication and muscle relaxers, anti-inflammatory, you don't need any of it with this surgery. You take Tylenol, Robaxin, and you're done. One night. By the next day, the pain is gone. There's very minimal pain because there's very minimal trauma. All right, we're going to be done in a few minutes. We've shown you some nice videos. You can go back and watch on facet pain, disc pain, the Deuk laser disc repair, how we treat these issues here at Deuk Spine. This is state-of-the-art spine surgery, most advanced in the world. Unfortunately, it will take the rest of the world 100 years to catch up. Some surgeons will start doing this sooner, but as far as it becoming what everybody does, they have to be trained. We have to have more of this equipment available. Endoscopes, lasers, these are all very expensive to buy. Very expensive. So, any questions?
At this moment, no current questions.
All right, we are a minute away from being done. For those of you who don't know, the laser fiber has a glass part in the middle. It transmits laser energy from a machine here in the operating room that creates laser energy. It is a holmium YAG laser made in Israel, the best laser in the world. That's what we use. All right, here's a piece of herniation, one of the last ones. You can see I cut it off with the laser because it was stuck to the annulus. This is the annular debridement we talk about, removing the herniations out of the annular tear. 30 seconds. Any other questions?
At this moment, no current questions.
All right, if you have questions, type it up. I come answer it for you. Otherwise, we have another one of these surgeries in about 30 minutes, 20 minutes. So grab some popcorn or birishki and come back and watch, okay? This is the foramen. And I just cleaned it out. It looks good. No more herniation. Finish. You ready, Dr. B?
Yes, please, thank you.
Little antiseptic. Betadine. Rinse. Type your questions. I will happy to answer them face to face. We have another one of these surgeries shortly. The patient has 2 disc herniations once again. Today we're doing 3 cervical discs, 3 cervical patients. We lost 1 drop of blood, 1 drop. Not even a full cc. You guys see the incision?
Yes, we do.
For my Russian friends, metric system, 4 millimeter. Okay? That's it. Let me have the benzoin and the stuff so you can break down. Here, isn't this it? All right, very good. Let's get the room turned over. Thanks for watching. I'll be come and answer your questions. Henry, let's run one of our testimonials.
Yes, sir.
I'm here with my patient who traveled from California, Northern California. He had a herniated disc at C5-C7. It was a small disc bulge. He was told by the doctors in California that he should just live with the pain, give it time, and eventually he'll need a fusion. Is that right?
That is correct. I was told that within 5 years I would be needing surgery. So basically what they were saying, live with pain for 5 more years and then we'll do something about it. One of the things that I've seen a lot of the videos is testimonials, and I will always say, this doctor sounds too good to be true. And actually it is true. I appreciate you, doctor. I really think that is really nice procedure, and the staff here is really nice. They're always very friendly and kind to get you through the process, because when you get told so many times that that's your new life, it's kind of, you're always thinking, is really the way I want to live? If I'm going to live a lot of years, why wait with pain? You know, you need to do something different. And always, whenever you see videos, you're always a little sketchy and saying, maybe it's not true. Maybe this is not what it is really saying. But today, when I felt with no numbness and no pain on the neck and just going through the process, I really been blessed. I'll be flying to California today. I honestly can't say much. You know, it's a miracle. Whenever I heard the testimonials, they say you're a tool for God. It actually seems like that's the way it is. It's a miracle through you. God works through you, and it's awesome to feel better, you know?
I'm so happy for you and your lovely wife who's here with you. You can see you had a tiny little incision. You had the Deuk laser disc repair for your herniated disc. You can see we were in there with the laser, cleaning out that foramen on the right side where the nerve was being pinched. There were a lot of pieces of herniation in there. And the laser cleaned them all out, and your surgery went perfect, and here you are less than 24 hours later. Feeling good, huh?
Well,
With
yeah.
a smile on your face. That's what I like to see.
You know, it's a smile of happiness. It's a smile of joy, you know, that it is doable. And I think no one should be able to be living with pain. I was so happy to see testimonials when they used to say, well, the one regret I have is not going in earlier and living 18, 20 years with pain. For me, it's been 3 years since July of 2020. It's been miserable because I've been with pain. And I've been told by doctors, let's just take time. I did all kinds of physical therapy, acupuncture, you name it, everything that's out there, and nothing seemed to help. And today, with 1 day of getting something really that's gonna be for life, it's amazing. It's a smile of joy, you know? If you are going through this trouble, don't hesitate on sending your MRI. When I did it, I sent my MRI for free review, and my answer was, yes, you are a candidate. Here I am today, flying back with literally no pain on my neck and no numbness on my hand, which I miss that. That's awesome.
It's wonderful. Now, what is your native tongue? What is your native language?
It's Spanish.
Are you from Mexico originally?
Guadalajara, Jalisco, Mexico.
Guadalajara.
Yes.
One of my favorite songs. Can you tell them in your native tongue how you feel?
Quisiera decirles que si están teniendo problemas con una hernia en su cuerpo, manden su MRI, es gratis y les van a dar un resultado, una verificación si ustedes son candidatos. No vivan con dolor, porque el dolor les va a causar toda la vida y los doctores allá afuera les dicen que no hay solución, pero las soluciones existen, simplemente las tienes que buscar y creer, tener fe que tú vas a estar mejor. Si Dios te mandó a este mundo es para que vivas bien, no para que vivas con dolor. Así que te recomiendo que por favor tomes esto en serio, hagas ese paso de mandar tu MRI gratis y habla ya sea con quien tengas que hablar para que ellos te empiecen a guiar y te digan qué es el siguiente paso que tienes que tomar. Así que una recomendación con Dr. Deuk. Muchas gracias.
Muchas gracias, amigo. And Feliz Navidad.
Feliz Navidad. Gracias.
Safe travels, my friend. Thank you so much for sharing. And good morning, I'm Dr. Artie Majan, CEO and founder of the Deuk Spine Institute. I'm here with a patient who has had his neck fixed. He had a herniated disc. We did his surgery just yesterday.
Yes, sir.
It was outpatient, Deuk laser disc repair, endoscopic. How do you feel today?
I'd say probably 90 to 95% better, for sure.
Awesome. And what kind of problems were you having before that brought you here?
Severe balance issues, tingling in my arms and fingers. I had pain running down my leg, but I don't have nearly anything today. So big difference.
And your insurance covered your surgery, is that correct?
Absolutely.
And who do you have to thank for that?
Well, we've got you for one, and your whole staff has been friendly and kind, and you guys have always been on point with everything, getting back to phone calls and emails. It's been a hell of a process. Much appreciated.
You're welcome. And are you taking pain meds now that your surgery is over? A lot of people that have spine surgery, they're on painkillers for months afterwards. Are you on any painkillers?
No, sir, not at all.
None?
No pain enough to need pills.
Awesome. And you can see the small little incision. We went in with a 4mm incision on his neck, and we went through the front, back to the back side of the disc that was herniated, and we used the laser to clean out your herniation and get the pressure off your spinal cord and your nerves. Here you are now. Were you offered other types of surgery besides the laser?
I was a disc replacement of the C4-C5, I believe it maybe C6. The recovery time was 6 months, 6 to 8 months of no working, no lifting, none of that stuff. I chose to go with Dr. Deuk just simplistically of, his overall success rate and the transition of being able to get back to work and getting my life back.
Awesome. And you don't have a piece of metal in your neck?
No, sir.
It's all natural. We went in and used a laser to repair the disc, and there's no metal, no plastic, nothing left in his body. You get your natural spine. Anything else you want to say to your fans out there?
Hey, believe in Dr. Deuk and the Deuk Spine Institute.
Awesome. Thank you so much.
Thank you.
All right. Good morning, I'm Dr. Deuk Majan. I'm here with one of my patients who underwent surgery yesterday with the Deuk laser disc repair on his cervical spine. And he's here less than 24 hours from his surgery. And how are you feeling today?
I'm feeling great. No more neck pain, no more arm pain.
So you came to us here at Deuk Spine because you were having neck pain and it was going in your right arm and it was affecting your work, your quality of life, right? Tell us about that.
I first started noticing a lot of arm pain and a lot of weakness in my right side arm, and that's my dominant arm, so I knew something was going on. And then finally I went and saw my primary care, who took me to a MRI, and that's when I noticed that I had some issues going on. And he referred me to Deuk, and I'm very pleased that I didn't have to search around. I was real confident from watching all the videos and testimonials that I would be the right choice.
Yeah, and you can see in your surgery here, we made a tiny little cut on your neck in 2 spots. 4 millimeters because you had 2 discs that needed to be fixed, so were separated. And we used the laser to remove the herniations along with the endoscope. We did an annular debridement, cleaned up the tear that was there in the back of your disc. Everything went really well. You didn't have to have a fusion, did you? I mean, that's what most doctors will tell their patients. They need a fusion or an artificial disc.
Correct. I didn't have to get the aggressive plates put in. I'm real happy that it was just 2 little holes. That's it.
And it was outpatient.
Yes, I was home laying on my couch within an hour after the surgery. So
Within an hour. Yeah, that was nice to be able to recover at home.
Yeah.
Not have to go to the hospital.
Correct.
Well, is there anything else you want to share with your audience?
My wife and I both came in a little nervous yesterday, and the staff just comforted us and very professional, very caring, explained everything from the beginning to the end. We were very pleased that we chose this route.
So what's life look like for you now that you got these symptoms gone?
I'm hoping to go sit on the beach this afternoon.
And you will. Very good. Congratulations on taking it and doing so well.
Thank you.
All right. Have a nice day. Okay, another successful cervical Deuk laser disc repair. I showed everybody the incision. It's right here. It's in the front of the neck. I go in between the trachea, esophagus, the carotid sheath, the sternocleidomastoid. I go between them. It's about 1 millimeter of space. And we did a small incision, 4 millimeters. I fixed both discs. We struggled a little bit because he has a thick neck and his soft tissues aren't moving very much. He's had some radiation to his neck before for other things. I think he's had surgery done. And so there's a lot of scar tissue in that neck, but we were persistent, and we stuck to our a disciplined approach and adhered to the principles of doing the surgery safely and effectively, and we got it done. I had to bend some of the dilator a little bit, but we were able to get the tube in and get the 2 discs fixed. So I'm really hoping that he loves his results and he's happy with the pain relief he has. He did not want a fusion. He came all the way here from another place in Florida, a couple hours away, and he said, I do not want a fusion, I want this surgery. So we did it and we got it done, and I think he's going to do fantastic. Any questions?
Yes, one question coming from Lanu once more on YouTube asking, do pieces of herniation ever attack your laser?
The pieces of herniation do not attack the laser. What you're seeing, Lanu, is that, remember, we have a tube that goes to the back of the disc, right? I used to have a straw in here, but now it's gone. Oh, actually, I have my straw from my coffee. So I'll show you with this. Okay. This is a really big straw, by the way. Okay, not like the one we used for surgery. So we put this in, went down to the disc and went to the back of the disc, and we were looking through the center of the straw all the way down here, and we could see the herniation, right? And what you don't know maybe is that I'm running through here cold irrigation, which is saline solution constantly flowing under pressure, and it's as soon as my laser releases a piece of herniation, normally it would just lay there and not move, but because of the flow, that's part of our technique, the flow pushes that herniation out, up and out. And that's why you see them jiggling and moving around with the laser. It's not that they're attacking the laser, it's that they're floating out because of the hydrostatic pressure of the irrigation that I use.
And those are the questions.
All right, we're done with this 2-level. We got another 2-level cervical. The next patient comes from, I want to say South Carolina. I could be wrong, but Kentucky.
Yeah.
All right, the next patient comes from Kentucky with his wife. He's having 2 discs fixed. One of them is severe, and I'm very concerned about it. He has severe spinal cord compression. But we're going to go in and fix it. I told him that he could do a fusion. He could also do the laser.
He has like 5 disc herniations, but only 2 of them really need to be fixed today. The other ones aren't causing symptoms, but they could in the future. He does not want fusion. He did not want laminectomy. He did not want ACDF. So we're going to do the DLDR, and hopefully it'll be successful for him. All right, thanks for joining us. Thank you, Henry.
Of course.
Had a great surgery, and we got another 1 or